Hello dear students. Today's topic is topographic anatomy of the head and neck and operative surgery. We start with the cranial borders. So cranial border begins at the mental protuberance, continues along the base of the lower jaw to the external auditory canal and along the superior nuchal line, which is the external occipital protuberance. There are two parts of the skull, cerebral and facial part. So the cerebral region is divided into the fornix and the base of the skull. The fornix consists of the frontal parietal occipital region, peritemporal and mastoid regions. The inferior part of the skull is called basis cranii. There are external and internal bases of the skull. The facial region includes orbital area, nasal area, mouth, chin, buccal area, parotid mastoid area. So moving to the meninges of the brain, they're distinguished as dura mater, arachnoid and pia mater. A hematoma is a hemorrhage with the formation of a blood clot in a cavity. So the types of hematoma we have intracranial hematomas divided to epidural hematomas, subdural and subarachnoid, and intraventricular hematomas. And soft tissue hematomas classified as subcutaneous, subaponeurotic and periosteal hematomas. An epidural hematoma is a bleeding between the outer surface of the dura mater and the bones of the skull. Subdural hematoma develops between the arachnoid and the dura mater of the brain. Subarachnoid hematoma is a hemorrhage between the arachnoid and pia mater of the brain. An intraventricular hematoma is a hemorrhage located in the ventricles of the brain. Next, we'll talk about soft tissue hematomas. The first is a subcutaneous hematoma. It's a hemorrhage into the subcutaneous tissue with the formation of a limited cavity filled with the coagulated blood resulting from damage of blood vessels. Rupture of the blood vessels. Aponeurotic hematoma is an accumulation of blood in the space between the aponeurosis and the periosteum. And periosteal hematoma is a hemorrhage between the periosteum and the bone, and its borders precisely outline the bone and do not go beyond its limits. So next we'll talk about ways of spreading the purulent process to the base of the skull. It's divided into two, contact hematogenous and lymphogenous. So first one, the contact acute and chronic diseases of the orbit can spread them, pass from paranasal sinuses next to the middle and inner ear, osteomyelitis, from osteomyelitis inflammation of the membranes and substances of the brain. Number two is your hematogenous, and through the veins of the nasal and ear cavities, infection spreads to diploitic veins, causing thrombophlebitis of the veins and the meninges. The third one is along the lymphatic gaps through the subarachnoid space to the anterior cranial fossa and empyema of the frontal sinus. So next, moving to the clinical anatomy of the neck, the borders, the upper border runs along the lower edge of the lower jaw, the apex of the mastoid process, the superior nuchal line, and the external occipital protuberance. The lower border is a jugular notch of the sternum, the superior edge of the clavicle, a line drawn from the acromial process of the scapula to the spinous process of the seventh cervical vertebra. Neck triangles. So in the neck region, we have medial and lateral triangles. Within the medial triangle, we have a submandibular Pirogov submental carotid triangle and scapulotracheal triangles. Within the lateral triangle of the neck, there are scapular-clavicular and scapular-trapezoidal triangles. So first is submandibular triangles, bounded inferiorly by the anterior and posterior bellies of the digastric muscle and superiorly by the inferior edge of the lower jaw. Pirogov's triangle. The triangle is bounded anteriorly by the posterior edge of the maxillary hyoid muscle, superiorly and inferiorly the posterior belly of the digastric muscle, and superiorly by the hypoglossal nerve. The bottom of the triangle is formed by the hyoid lingual muscle. Submental triangle, the boundary of which are the anterior belly of the digastric muscles and the body of the hyoid bone. Carotid triangle. Posterior border is the anterior edge of the sternocleidomastoid muscle. Anterior and inferior borders are the superior belly of the scapulohyoid muscle, and superior border is the posterior belly of the digastric muscle. The scapulotracheal triangle is bounded superiorly by the scapulohyoid muscle, medially by the anterior midline of the neck, laterally by the anterior edge of the sternocleidomastoid muscle. The scapuloclavicular triangle. So the medial border is the posterior edge of the sternocleidomastoid, inferior border is the clavicle, superior border the lower belly of the scapulohyoid muscle. Scapular trapezius limited to the scapulohyoid muscle, trapezius, and sternocleidomastoid muscle. Thank you very much for your attention.